In continuation of our learning series, I will continue to discuss on the solutions to lasting longer and curing quick ejaculation. My name remains Dr. Madwako, and this evening I'll be taking a look at some of the questions which you have raised, and I will be using them as points of contact to reach to other persons who may have such relevant issues, and that will equally provide a fulcrum for us to delve deeper into some of these issues that pertain to men and sexuality. This is courtesy of lastlongerng.com, Nigeria's website for men of all ages, young, old, middle aged, whatever the problem is, in terms of lasting longer, in terms of satisfying your partner. You can head over there, lastlongerng.com, drop off your comments, and we'll be there to take care of it. So right away, without much ado, I'll go ahead and read out what someone had sent in as a complaint, and I'll use that as one of the questions we would answer and touch other issues that pertain to surrounding challenges. Of course, the names will not be read out for issues of privacy. I am having issues with maintaining erection. When I get erections, it's not that rigid and it doesn't last long at all, in bracket less than a minute. I find it hard to penetrate, and when I do, I lose the erection totally, almost immediately without ejaculating. I also never have early morning erections. So you could see that this man is talking about early morning erections. Aside early morning erections, he's still talking about not being able to maintain erection when he's in the introital part of his partner. But first and foremost, before we understand the challenge this man has, or the challenge another person who is listening to me has, you would need to understand how erections come about. And how erections come about is basically blood flowing into the penis. So let me assume that this is the penis, and I'm sure you may not be able to have a very good view of what I'm drawing here, but just a schematic diagram of the penis. And if you have the penis, let's see whether you could have a better view. Yeah. This is a schematic diagram of the penis, and you have blood vessels that run on top of these smooth muscles. That is why when you have an erection, you would see those fine blood vessels become bigger. They become bigger because blood flows in, and when blood flows in, the valves, there are valves, V-A-L-V-E-S. There are venous valves that lock up, ensuring that the blood that has flown in doesn't flow back again. And that is what gives you a sustained erection. Now, there are hormones that help you with this blood flow. The chief hormone is known as testosterone. Now, that is the male sexual hormone. That male sexual hormone that is responsible for blood flow is equally responsible for all male sexual characteristics. What do I mean by all male sexual characteristics? I'm referring to the birds. I'm talking about the appearance of the mustache, the appearance of the bird, the broad shoulders, the libido. Libido is the desire you have to make love to a woman. That is libido. Now, all those things are controlled by this hormone known as testosterone. And testosterone is equally responsible for this blood rush that gives you a sustained erection. However, these blood vessels on the penis are supported by the smooth muscles of the penis. That is what you can regard as the flesh of the penis. These smooth muscles of the penis are just like every other muscle. What do I mean by they are just like every other muscle? They still respond to the law of Lamarck. Lamarck talked about use and disuse atrophy. What do I mean by use and disuse atrophy? Any part of the body you exercise, any skeletal muscle or smooth muscle of the body you engage, that part of the body grows bigger, that part of the body gains stamina. And that is the same thing that happens with the smooth muscles of the penis. A very frank analogy would refer to athletes. If you see footballers or people who engage in marathon races, you will notice that they have a better developed thigh, they have better developed arms, they have generally better developed muscles. They've gotten rid of the flabby part of their bodies, the fatty deposits. Why? Because they've put those muscles to work. And that is why their muscles would always have a greater capacity for stamina, will always have a greater capacity for performance, because they've put those muscles to work. And that is the same thing that happens in the smooth muscles of the penis. The more you put those smooth muscles to work, the more you will see the greater ability of the penis for erection. Now, how do you put those more smooth muscles of the penis to work? Putting those smooth muscles of the penis to work is not equated to the frequency of sexual exercise. Frequency of sexual exercise has no business with putting those things to work. Now, because in sexual exercise, you are actually going to and fro. It's a unidirectional movement. You are going to and fro, and that is only exercising the smooth muscles of the penis in one plane. But for you to gain the effects of exercising the smooth muscles of the penis for greater strength, for greater stamina, you would need to do graduated penis exercises. Now, penis exercises, it's where you exercise the penis in all planes. There are instruments you can use in exercising the penis in all planes. You can use the penis devices, you can use the penis tools, you can use the penis pump, the vacuum pump. All those are tools you can use in exercising and bringing out the stamina of the smooth muscles of the penis. Given that you have strengthened the smooth parts of the penis, what do you do about the blood vessels so that they remain open and allow blood to flow in so that you have good erection? Before I continue, it will be noteworthy to identify those agents, those disease elements that could narrow down these blood vessels. And when they narrow down these blood vessels, what happens? You have a clogged up blood vessel. You have a blood vessel where the lumen is narrowed. For example, just like what I was just drawing on the body, which I know you may not be able to see very appropriately. If I have a vessel, a blood vessel that is this big in width, if we have accumulation of substances within the intima, we'll have a narrowed diameter of that blood vessel. And when you have a narrowed diameter of that blood vessel, what will happen is you will have poor blood flow into that vessel. One of the conditions is hypertension, uncontrolled hypertension. Another is diabetes. Another, which you cannot do anything about, is age. So let me zero in on age. After the age of 40, or for some persons 35, testosterone, which I mentioned earlier, which is the chief hormone that drives all these activities, takes a dip. What do I mean by it takes a dip? It starts a steady but sure decline. And when it starts that steady but sure decline, it means that your urge will decrease. It means that your erections will decrease. It means that your sexual seeking behavior will decrease. And that is why you see men both 35 complaining about their inability to satisfy their partners, because what is happening here is they are not hypertensive, they are not diabetic, but they are aging. And as they are aging, those blood vessels are prone to have accumulation within those blood vessels, as well as decrease in testosterone. And remember, as they are aging too, the smooth muscles of the penis are not exercised. So, given that you've had a basic understanding of what happens during erection, basic understanding of what happens to bring about sustained erection, how can you help yourself in terms of having sustained erection as you age, having sustained libido as you age, and having that strength and stamina that is sustained as you age? Now we've identified the factors responsible. We've identified testosterone as being responsible. We've identified lack of exercise of the smooth muscles of the penis for being responsible. We've identified the accumulation within the blood vessels running on top of the penis for being responsible. Now, the next phase is, what are these things that could accumulate within the blood vessels? The chief is cholesterol. And when I talk about cholesterol, I'm referring to lipids. I'm referring to fats and oils. And there is only one place you could get fats and oils in so much quantity, and that's your diet. So as you age, if your diet is still high in cholesterol, if your diet is still high in fats and oil, you would definitely accumulate these within the vessels. And when you accumulate within the vessels, it predisposes you to polyheart attack, predisposes you to hypertension, predisposes you to diabetes, and most importantly, relevant to what we are discussing, predisposes you to very weak erection. Because as you can see, the diameter of those blood vessels that allow blood to flow in and allow erection to happen has been narrowed. And when they are narrowed, you have very poor blood flow. And when you have very poor blood flow, remember, not only that, you have very poor blood flow, you have increasing age, you have decreasing testosterone, and you have a smooth muscle of the penis that is not exercised. So all of them work to make sure that erection dwindles. So number one, what you can do is to modify your diet. And when you modify your diet, you reduce the number of the amount of fats and oils you take in, the amount of cholesterol you take in, and make sure that you go more for plant sources. On our website, lastlongerng.com, we talked about the watermelon recipes. We talked about the ideal breakfast that could help you restore testosterone, that could help you restore your libido, and help you in terms of cholesterol modification. You could go to our site, you'll see lots of recipes there which you could choose from, and those will help you with reducing testosterone. And when the testosterone is reduced, what you can be sure of is that these plaques that are stored will be mobilized out of that place, out of the vessels of the penis, by the body. And when they're modified and removed from that place, you have a bigger lumen coming back to its normal size, and you have more blood flow. That is one. Two, another way you can reduce cholesterol that has laid in those intima is by exercise. And now when we talk about exercise, we talk about graduated intense exercise. It's not enough to take a walk of 30 minutes where you are walking slowly. It doesn't do much for the body. it will be preferable you do 10 minutes of intense exercise at home. There are videos on our site. You can equally request to have the DVD sent to you, the DVD for home workouts, where you could slot in, choose any of the DVDs or any of the videos for intense workouts, and do that in 10 minutes. You can do that in the morning and in the evening, or you can do it once in a day. What it does for you, reduces the cholesterol accumulation within the vessels of the penis, equally reduces cholesterol accumulation at all parts of your body. And what that does is to open up the vessels so that you have more blood flow. And when you have more blood flow, you probably have a better erection. Another thing you can do, which we inadvertently mentioned before now, is to exercise the smooth muscles of the penis. I talked about using the penis tools, the penis pumps, the penis valves. You can use this to exercise the smooth muscles of the penis. How to use them, they're on our site, lastlongerng.com. You could equally send in your name and place an order, and you could have that delivered to you. You could use it for the next 10 years or the next 15 years. It's part and parcel of exercising your body. So if you see exercising your body as something you do for overall health, exercising your penis with any of the penis tools, exercising the smooth muscles of the penis is part and parcel of the things you do as you age to make sure you maintain optimal performance in bed. Another, which we equally talk about, I think we mentioned it the last time, aside the decrease in age, is testosterone, making sure that we have restore our testosterone back to normal levels. And how can you restore your testosterone back to normal levels? You could do that by the aid of diets. We talked about the diets. You could do that by the aid using the Vigo carb. The Vigo carb helps you restore your testosterone levels, and how it's taken, you take one in the morning and one in the evening, and it helps you restore back your testosterone, helps you restore back your erection, and helps you restore back your libido. For men who have issues with fertility, the Vigo carb is equally there to help them restore their sperm volume and semen volume as far as fertility is equally concerned. So you can see that for the man who asked that question, if we are to recommend to him, we'll ask him, number one, to practice penis exercise. We'll ask him, number two, to reduce cholesterol intake in his body, in his diet. We'll ask him, number three, to exercise briskly and intensely. We'll ask him, number four, to use the Vigo carb. And we'll ask him, number five, to do these things consistently. I know you may be asking, what of the man that is hypertensive? What of the man that is diabetic? For the man that is hypertensive, for the man that is diabetic, he can still use these procedures we've mentioned. And for him, these will achieve ×2 benefit. What do I mean by twice the benefit? For example, for the diabetic, if he exercises, he's going to equally have reduced blood sugar, which helps him in reducing the diabetic load. Likewise for the hypertensive. But it's equally very important to note that for the hypertensive and the diabetic, some of the drugs that are prescribed, the amlodipines, the diuretics, the nifedipines, the codovans, most of these drugs have their side effects on the penis and give you weak erection. But that doesn't mean that you should stop your conventional medications. What it means is you have to counter that effect by exercising the smooth muscles of the penis regularly, by making sure your diets are free of cholesterol, and by using the Vigo carb, which you can use in combination with any of the drugs you are taking. You can take it in the morning and you can take it in the evening. Let me clarify here that the Vigo carb is not Viagra, which you have to take 2 hours or 3 hours before sexual intercourse. In that case, it's embarrassing, where you have to begin to look for your pack of drugs before sexual intercourse. What we aim at, and that's the essence of this teaching, is a complete cure so that you're able to take yourself out of that embarrassing zone. So we've answered this question. Let's look at the next person who asked the question. He said, "Sir, during romance, I find myself released. What is the solution?" For this person, his problems are quick ejaculation. So how can he address this problem of quick ejaculation? Quick ejaculation is exactly aptly what you described, where he ejaculates before even sexual intercourse has started, or where he ejaculates before the partner has gotten to the height of sexual excitement. And in that case, one of the culprits which I have personally discovered in my course of working with men and helping men restore their sexual abilities is masturbation. Masturbation is a key element in the causative factors of quick ejaculation. There is no way you'll be masturbating and expect to last long and not have quick ejaculation, because the mechanism of masturbation stimulates and overstimulates the nerve endings of the penis, and when that happens, you lose control. And when you lose control of the ability to control your ejaculate, you can no longer control the sensations. The sensations are so much for you to bear, and you pour your load even before you start. So number one, if we are to address that issue, we're going to pose a question to him, which is one, please, do you masturbate? And let's assume that he says no, he doesn't masturbate. Number two approach would be to find out, does it happen with every woman? If it happens with every woman, then he may be suffering from generalized anxiety. And in that case, we'll ask him to take control training of the penis. Control training of the penis, you can't still do that with the penis exercises, using the penis tools or the penis devices, where you train your penis, inflate up to a point and deflate, inflate again up to a point and deflate. You train your penis to be able to handle sensation. You train your penis to be able to stick there till you come together with your partner and last long, as well as training your penis to increase in size and gait. So you have a win-win situation there. However, there are methods you can use to achieve a cure to quick ejaculation and train your body to make sure that quick ejaculation is taken out of the way. You can use the stored delay spray, which is on our site, lastlongerng.com. You can have sent to you. The stored delay spray can be used 20 minutes before sexual intercourse, sprayed on the penile cap. What it does for you is to make sure you're able to control the sensations and helps you with the curative mechanism to quick ejaculation. But I must mention here that if you still practice masturbation, this will not be effective for you. The first thing you would do is to let go of masturbation. To let go of masturbation, there's an article on our site, lastlongerng.com, where you will see the stepwise approach you can adopt to make sure that masturbation is a thing of the past. There are other methods you can adopt to help you cure quick ejaculation. Some of them are in the breathing techniques. Some of them are the gums you chew. Yes, the gums you chew. The other ones are in the positions you adopt. All these are found on our site, lastlongerng.com. You could go there, drop off your comments, see what's going to help you. If you have questions, you can send it in just like they've sent in their own questions, and I'll always take time to dissect them, find solutions, and you last longer and satisfy your partner. You could go down there and subscribe, hit on the subscribe button, subscribe on our YouTube channel, so that you keep getting regular peer-reviewed exercises like this, where we talk about solutions and help you with the cure to lasting longer and quick ejaculation. Don't forget, subscribe, spread the news, share the YouTube video. My name remains Dr. Madwako, and I'll be with you next time. Thank you.